Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on my program, we have different guests and we talk about different programs, services, things that are going on in our community that I think will be of interest to you and your family. I have a very exciting guest on the program and we're going to be talking about some pretty timely issues. So please stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Sue Kern, who's the Emergency Preparedness Coordinator here at KRMC. I have to walk myself through that. That's a lot of consonants. Thanks for being on the show, Sue. It's pretty timely for us to be talking about emergency preparedness with all the talk in the news right now about Ebola. So is that something that's kind of becoming an issue for you?
It's definitely a hot topic in the hospital these days,
Right.
especially in the ED and in pre-hospital. We're not exactly expecting an Ebola crisis, but having said that, we need to be prepared. So we've been preparing for infectious disease processes and looking at what we have and updating it to try to stay under CDC guidance.
Okay.
And every time we get there, they change it. And we get there, and then they change it. So they changed it Tuesday, and so we're updating it again. And we're working with our pre-hospital providers. I'm also the EMS coordinator. So I work.
When you say, I'm sorry to interrupt, but when you say pre-hospital, is that outpatient?
No, that is emergency medical services,
okay.
other paramedics, basically,
Okay.
both fire and private ambulance in the
Okay.
area. And I work closely with them in my role as the base station with the EMS coordinator and with my emergency preparedness role, because they go hand in hand. And so we all need to stay on the same plane. So whatever their level of protective gear is, so is ours.
Okay.
So we're working on getting the word out. This is the new CDC guidelines, and for pre-hospital and for ED and for the hospital, anybody that takes care of this type of patient, what to do when they present, and how to protect the staff and how to care for the patient.
Okay.
So that's kind of what we've been working on this week.
Okay. Well, and it is, of course, everybody is aware of Ebola just because it's hot on the news right now. But you and I both know that for Kingman, especially, influenza is probably a bigger concern and more likely to affect our community even than Ebola.
That's
right?
exactly so. So far, none of our citizens have died in the United States of Ebola. The one patient that did was from South Africa.
Right.
So that's one guy in 200 million people. And every year, depending if it's a mild year for influenza, 3,000 people in the country die. And if it's a bad year, it can be up to 49,000 people die.
So
and
it's a significantly
It's
bigger number of people
right.
that will be impacted.
Right. Complications of flu, especially in the young and the old, can frequently lead to pneumonia and complications and then death.
Wow.
And so the simple things, whether it's Ebola or the flu, are the same.
Okay.
If you're sick, stay home, cover your cough, don't use your hands, do the vampire cough,
right.
and sneeze.
Okay.
And, get your flu shot.
Wash your hands.
Wash your hands and wash them frequently. I keep the alcohol gel in my car, in my
Okay.
pocket, and whenever I get in my car, before I touch anything, I use the alcohol gel.
Smart. Okay.
The supermarkets offer the wipes. Wipe it down.
Yeah.
Because all of those things are just simple things that you can do
to prevent yourself from
getting sick. Viruses, it's not just, there's an Ebola germ in the country. It's
Right.
all of these multiple viruses and bacteria that we can kind of control a little bit.
Right.
You know?
And that is maybe one of the biggest things for an individual. I think what is the most scary sometimes is for things that they feel they have no control of.
Right.
So
when we know there are steps that we can take personally to protect ourselves and our families, whether it's from the flu or Ebola or any of those other contagious diseases. I mean, those are things we need to be aware of year-round.
Right.
Whether Ebola's here or not. And I think sometimes we forget about that.
Well, and that's true. In a general emergency preparedness plan, whether it's a biological like Ebola or the flu, or if it's chemical, or if it's trauma, if there's a whole bunch of people coming from earthquakes in California, we have enough food in this city for one day if the trucks cannot.
For one day?
For one day if the trucks
Wow.
cannot run.
That's not very long.
No, it's not. So you should always have a plan. You should always have extra water and enough food for 2 weeks. And you should keep that, per family member. And you should keep recycling it. So don't supply a bunch of stuff you don't want to eat.
Right. or put it away and then
forget about it.
Yeah, and then it's expired and
right. So you should have a running plan for at least 2 weeks. I know Walmart has for $25 a bucket.
Those big
and I think those have
containers.
Longevity in them.
Okay.
That they last for quite a while. They have a date that's pretty long on them. Water. The hospital has a plan. We, as part of the internal code, triage internal, we have ordered for emergency preparedness through some grants enough food and water for more than the required 5 days. We have continued to use some money to store water and food for the hospital employees and patients should we come across a situation where we have to stay put or can't get food.
Okay.
But as an individual, you should have a plan for where you're going to meet. If it is an external outside source coming and interfering with the community, or if there is something like an earthquake, even though we're like an earthquake, tornado, in low risk, right? We have almost none of those natural disasters.
Right.
Ours are going to always be either biological or man-made.
Or we get impacted by from
another
outside,
right?
Like
And that's our biggest concern when we sit down with the local emergency planning committee. Their concerns are, what happens if something happens in Las Vegas or something happens in LA and all the people come through, because they can just take all of the resources that we have and thought we had enough for our community.
Right.
So you should always have sort of a plan where to meet and what you're going to do and that type of thing.
And again, I think planning ahead, realizing there are steps you can take to have control over your own family and your situation also helps to allay fears. And
True.
I know that there have been concerns, what steps has the hospital taken? Of course, right now they're talking about Ebola, but I think it's good for our community to know that we have taken these steps for any kind of an emergency, that we are prepared. And for Ebola, I know right now we have like just a basic screening questions that we ask, right?
Right. We actually have a fairly defined plan that will be current with today's CDC plan.
Written in pencil, so when it changes tomorrow.
Certainly that I'm going to be able to maybe have to cut and paste
Right.
If they change again. But if you present to the ED and you have Ebola, or you have been to South Africa, or you have a fever and maybe you've been to an international airport, the nurses have a plan of what we can do, where we can put you, keep you safe, keep the nurses safe. We have a whole section of the ED we're going to be able to shut down. If you're in the waiting room at the time, we will notify you immediately that you have been exposed. We're calling county health right away. We've been working with them almost daily as we develop our plans to make sure all the hospitals know what the other hospitals are doing, what resources we have, what county health's role is, who's going to come. County health is called early in the game. We'll review our plan prior to a patient coming, hopefully. So they're going to probably come early next week and see what we have done and make sure it's in compliance with they understand the rules are. We have ordered extra PPE,
which is
protective equipment,
personal
the
protective equipment. That's what it stands for.
And the masks and the booties and the aprons and the gowns that are all non-permeable. And when I ordered it was last Friday, and on Tuesday they changed to PAPAs, which is non-rebreather sort of thing that you put like over your head, or N95s,
The mask.
and a face shield. So we have 6 or 8 PAPRs on campus, and it's been a while since we've used them, so I put one together this morning, and I'm going to order some new cartridges. So we'll have that up to date. We have N95s here, so we have the equipment, and we've ordered extra that are starting to arrive, and again, I'm going to order more again today as the rules change.
Okay.
Trying to,
Keep
stay
up.
afloat.
Yeah.
So I figure by the time it really, if anything hits, we'll have enough time to sort of prepare the community and have our staff educated, and we've already done training on how
Right.
to put them on and how to take them off so we don't cross-contaminate. And it's killed easily. It's no different really than the AIDS of the 80s. When we first heard of AIDS, we really didn't know what it was, and you couldn't test for it, and they didn't get sick right away, but you could be carrying it for 10 years. And then
10
get sick.
years,
Yes.
really? I didn't realize it was that long in incubation, or it
Yes.
could be.
Yeah, it could be 10 years.
Wow.
So there was nothing we could do. So we used to do all of that when we take care of patients that met the criteria for AIDS.
Okay.
And again, it wasn't airborne, it's droplet, and
So let's explain the difference between when we say that, because I was just thinking of that. When we say it's not airborne, it's droplets. What exactly
so that
does
means if
mean?
you sneeze, it could be in the spray from your nose, it could be in your
That's
saliva.
droplets.
Right, that's droplets.
Okay.
So it goes a few feet and then drops.
Okay.
Thus the word droplet.
Okay.
As opposed to in the air, like an aerosol where you spray it and it stays floating in the air, and it could,
Be there for a while.
be there for a while and hit somebody that just happens to walk by.
Okay.
So you have to be close, and they have to have somehow sprayed you. You can't really catch it unless you have their body fluid on an open part of yours. The difference right now between AIDS in the 80s and Ebola in 2014 is social media and people wanting to sell the news, basically.
Right, yeah.
So there's the
scare
science,
tactics.
right? There's the science of medicine, and this is what they have said. And then there's the media and the feeding into the buy our stories or listen to our stories. So we're going to make it as sensational as possible,
Right.
so that you will stay tuned.
Right,
How
come back and-
how they leave you hanging before they go to a commercial. It's the same thing. In reality, the science says if you wear a mask and eye protection and gloves and a gown, unless you're doing invasive things to the patient or the patient is very sick, and you've heard that the patient on the airport, on the airplane is not really contagious. He might be infectious, but there's a difference between infectious and contagious.
Okay.
But they're not that sick, so the viral load isn't that high. So they aren't shedding a whole lot of viral,
Okay.
cells at that point. But as they get sicker, it gets higher and higher. So that by the time they need to go to the hospital, and then they need to be treated, and we're starting to do invasive things, it gets higher and higher. And the highest point is when they die, is when they're dead. So the dead bodies are actually the highest, and that's the problem with South Africa, because they're culturally, they want to wash the bodies, and even though the government has forbid it, they're bribing the local law and stuff and constables and stuff to let them have their bodies and wash it, and that's how they're spreading it, because the viral load is very, very high. So we are responding, and so is CDC. We need to make our staff feel safe and our community feel safe, so does CDC. So we're going to these extraordinary lengths to keep the staff safe. But the reality is it probably is overkill, but rather safe than sorry.
Sure. Right.
The reality is, are you going to get Ebola this winter? No. Is it going to be sensationalized again? Yes. We haven't had one for probably 10 days now, no new outbreaks. So none of the staff from the hospital, the rest of the staff has come down with it. The second nurse is already clear. So what we're doing is effective.
Right.
The vaccine by GlaxoSmithKline is in human studies right now, and it looks to be effective and
Great.
out in 2015.
Okay.
I don't know how that'll be distributed. My guess is they'll save it for the areas where there's outbreaks and make enough, hopefully, to get it to South Africa so we can stop that.
Great. We're going to take a quick break and come right back because obviously there's still more to talk about. Thank you. We'll be right back after these messages.
We have a lot of antidotes placed strategically, actually, in Kingman.
Welcome back to Your Health Matters. My guest today is Sue Kern, the Emergency Preparedness Coordinator here at KRMC, and we're talking about Ebola, but also just general emergency preparedness. And I think another thing that I wanted to chat about is the programs, or that's not the right word, it's not a program, but what we do in conjunction with county and state officials to plan for emergencies. You talked about it before the break a little bit, but I don't know if the community realizes we actually have these scenarios that we don't know ahead of time. They just kind of throw it, this is the game that we're going to play type of thing, right? Mm-hmm. And
so we work closely with both county and the state, and we work very well with them as groups. So I just met actually 2 days ago with the state and other hospitals and county health, not only for Mojave but for Yavapai and La Paz County. We all work together as groups, and as we plan and identify potential disasters, we do drills, and we do them individual hospitals, and we do state drills, and we do just regional drills. So we have a drill coming up, and we actually have a decontamination tent, and we're going to set that up. And we actually have a patient surge tent. And it's really just an events tent, and it's not meant for long term, but if some winters we get so many patients that want to be seen at the same time, we actually run out of room. So if we set the tent up and then we can at least triage them there, we're going to set the tent up and kind of walk through how we can actually use it effectively if we have a big surge of patients, like if we have a big flu season, because everybody opted not to get their flu shots.
Let's hope that
doesn't happen.
No.
But we're going to practice that, and the flow of patients, and as an individual hospital. And the state later on in the month is doing a drill, and some years they do big drills. This year is just strictly a communications drill. We have many systems throughout the state that work on internet and satellite and ham radio, and how they communicate with us should this go down or that go down. We're going to work on that with the state. And then for our regional disaster, we're just now going to start planning it. And we have to have it done by July. And we have not yet come up with a scenario yet.
Okay.
So.
Well, and like I'm part of the Public Information Officers Group, PIOs, and in our role it's that communication piece, that whether it's getting information out to the media, who in turn, local media, who hopefully then in turn get it out to our community, whether it's, updates on whatever the disaster might be or where to go for help, those types of things. So we are prepared, and I think that is something we want to make sure our community knows, that KRMC and our staff, and like you mentioned, the outside groups as well, the fire and ambulance and police, we all do work together to make sure we have plans in place just in case.
That's
It's
true.
better to be safe than sorry.
And we have several forums. We have the local emergency planning committee, which is both private sector and public sector, and our emergency operations center, which Byron Stewart runs.
Okay.
And we meet with him and Jeff Browning, and they go through what happened in the county, what could happen in the county, are we meeting the state's expectations? And that's a whole group of people that we sit down and meet with, and I attend those. And then we also have the state, which is a separate group that meets with us for, we call it community preparedness.
Okay.
And we do different scenarios and issues with that, and then a lot of us sit on both committees so we can kind of bring it together. Then I usually bring it back here to this facility, and how we're going to play, not only individually, but as part of the community, part of the county, part of the state. It's a fairly robust state as far as disaster planning. Arizona is.
Well, and what's for Kingman, I think, we don't often or don't always think about the fact we sit right on the NAFTA trade route and I-40s and the trains and everything else. So it could be even not just a biological or even a chemical major accident, train accident. We've had that in the past. Explosions.
Been there, done that.
Yeah, bus accidents. Been there, done that.
Right.
So all of those types of scenarios.
Right, are things we have to prepare for. There's a lot of chemicals on I-40, on the trains, and we're very aware of that, and so is the state. We actually have an agreement with the federal government where we have a lot of antidotes placed strategically actually in Kingman, so that if that happens, we can use it. It has to be a federally declared emergency, but if it's not and we need it, we'll use it.
Yeah.
Forgiveness, not permission.
Yeah, right.
But we've participated with that for probably 10 years now. Probably we've been an identified hospital that has both pre-hospital and in-hospital resource for chemical emergencies should we have with them, because there is a lot going down I-40. We're very good at the major traffic stuff. We get that all the time.
Right.
We get that all the time.
Yeah, with big accidents and things.
Yeah.
Well, and then segueing back again to Ebola, and as we said before the break, the influenza is truly what is most likely to cause issues.
Right, the difference is people are used to the word flu and influenza, and they didn't catch it this year, so they don't need it, so they're not worried about it. Ebola is a whole new animal.
Right.
Same thing with AIDS. AIDS anymore, to our young nurses now, it's something they have never known a world without.
Right.
When I was a young nurse and it first came out, is what's happening to them with Ebola. And so it's that same sort of, we don't really know, it's a new word and to us a new disease. Ebola has actually been around for 50 years.
Okay, that's what I thought.
It's not new, but it's, you know, this is a big outbreak. I think it's the biggest outbreak. And the difference is, you know, we're going to be able to get a vaccine, and we have not been able to do it for AIDS because the virus of AIDS changes rapidly. We can't quite catch up. But Ebola in the last 50 years has only changed 5%.
Wow.
So they'll be able to do this vaccine, I think, probably not too much difficulty. You know, and up until recently, it's been confined, but it started with a 2-year-old baby and the whole village going out there at the baby's death and exposing themselves. The baby died of Ebola.
Oh, okay. And is that because it was more contained in the past? Is that why up until now they haven't really done much?
It was in the individual villages, not in the big cities. And you have to remember, Africa, where these things are occurring in these countries, they don't have a robust public health. The villages actually were better because Doctors Without Borders or whoever could go in there and say, this is what you need to do, and then the village chiefs would say, okay, and they would follow them. But when it broke out in the city, there is not a strong government there, and there's just a whole bunch of people living together with not a whole lot of leadership. And the sewers are not like ours, where they're decontaminated, it's just like one hole. So it just was sort of rampant because they don't have access to a lot of the things we have here.
That we take for granted, truthfully, here in America.
Yeah. So, I mean, a lot of that's the difference.
Wow.
Yeah.
Sue, I have to tell you, first of all, thank you again for being on the show today. I really feel we've provided some good, pertinent information for our community that I hope that they'll pay attention to, put their fears aside, and get their flu shot.
Yes, if nothing else.
Most important.
That's the one thing we can do.
Right. So thank you again. I hope you learned something new on the program today. I know I did. Join us again next week, and I'll have another great guest on the program.